today. I want to welcome everyone, including all of you, my colleagues in the House and Senate, especially Pennsylvania State Treasurer Stacey Garrity, for being here today. It is my distinct honor to welcome Robert F. Kennedy Jr., the Secretary of the United States Department of Health and Human Services, to Pennsylvania. And he's here to kick off the Eat Real Food Tour. So Secretary Kennedy's visit comes at a moment when real strides are being made to improve Americans' health, progress that is taking place right here in Pennsylvania through education, bipartisan collaboration, and a renewed focus on prevention, wellness, and eating real food. My name is David Rowe. I have the privilege of representing the 85th Legislative District right here in the Pennsylvania House of Representatives. My district is heavily agrarian, run by hard-working farming families that put food on the table for millions of Americans. And as an agricultural powerhouse, Pennsylvania is the perfect place to kick off the Eat Real Food Tour. Eating real food matters because Americans, including Pennsylvanians, are facing worse health outcomes now than ever before. In the 1970s and early 80s, obesity rates in the United States were around 15% for adults and around 5% for children. Today, however, obesity rates are closer to 40% for U.S. adults and about 20% for children and adolescents. Rates of type 2 diabetes diagnoses among U.S. youth have roughly doubled over the past 20 years, which is very concerning and pairs with the rise in obesity. Rates of non-alcoholic fatty liver disease increased by 50% over the last 30 years. Additionally, the U.S. has seen troubling increases in diet-related chronic illnesses over the years. Meanwhile, the cost of treating, managing these preventable chronic diseases in the U.S. is priced at $4 trillion annually and growing every year. We all know these costs are passed along, creating hardships and increased insurance rates for families all across the Commonwealth. Here in Pennsylvania, we in the legislature are focused on common sense, bipartisan solutions to make healthier food more accessible and healthcare more affordable so that every Pennsylvanian can live a healthier life. I want to take a minute to personally thank Secretary Kennedy because the last few years have taken me on a health journey of my own that I want to share with you all. My brother and I, we used to own a chain of gyms, and activity used to be part of my daily life. However, after a bad skiing accident left me unable to walk for almost a year, I fell out of my routine. I spent a lot of time inactive. I spent a lot of time eating things that were definitely not real food, highly processed without any real nutritional benefit. As a result, I put on about 50 pounds, and I had begun to accept that this was my new normal. I even went and bought all new suits because I had long outgrown my old ones. But in 2024, I had a wake-up call. My doctor told me that my rapid weight gain had put me at a high risk for prediabetes, and I needed to do something. So early last year, because of the inspiration of Secretary Kennedy, I went, as I like to say, full MAHA, because I started eating only real food. Whether it was meat, eggs, cheese, raw milk, honey, only real food made up over 90% of my diet. And in just 8 months, I lost the 50 pounds I had gained after my accident, and at my next yearly checkup, my doctor was impressed and told me, keep doing exactly what you're doing. So thank you, Secretary Kennedy, for being an inspiration and bringing common sense back to the American diet with the Eat Real Food Tour. Now, before we hear from Secretary Kennedy, we're honored to hear from several Pennsylvania leaders who have been deeply engaged in advancing healthier communities and responsible public policy. So at this time, it is my pleasure to introduce Senator Kristen Phillips-Hill, who has been a strong advocate for transparency, accountability, and policies that empower families to make informed decisions. Senator Phillips-Hill.
Well, thank you so much, Representative Rowe, and what a pleasure it is to host Secretary Kennedy today at our state capitol here in Harrisburg to encourage Pennsylvanians and Americans to eat real food. I'm Kristen Phillips-Hill, and I have the great honor of representing Southern York County in the Senate of Pennsylvania, and I am so excited to see friends, neighbors, constituents, right here in our capital, Rotunda. And I will tell you that Pennsylvania is so very fortunate to have a rich history as a national leader in agriculture. Agriculture that provides some of the very best food for our nation. And I look around my district and I think of Shaw Orchards, and they produce some of the very best berries. I think of Flinchbaugh's Orchard and their farm market, which has some of the best apples. Maple Lawn Farms that grows amazing peaches. Sky Blue Farms with their incredible steaks and fresh meats. And of course, our famous dairies, from Rudders to Perrydale, that produce the best milk. And speaking of milk, I need to give a huge shout out to our Senate Health and Human Services Committee Chair, Senator Michelle Brooks, for leading the fight to bring whole milk back into our schools again. Thank you for that big round of applause. She deserves it, because we are making school lunches great again. But we are at a challenging point as a Commonwealth. We recently endured a budget battle that none of us want to go through again. And a lot of it had to do with how much we spend. Our human services budget continues to grow at an alarming rate, faster than any other state agency, including education. And we're all up here to say that we must take care of the citizens who are the neediest and most vulnerable. And we need to let Pennsylvanians know that these programs exist to be a hand up and not a handout. Now, budget projections show our human services costs ballooning, with Medicaid growing from $7 billion in 2019 to more than $15 billion by 2027. And under Secretary Kennedy's leadership, we now have work requirements for able-bodied adults without dependents in order to receive Medicaid and food stamps. It's a novel concept. Healthy adults who do not have children are now required to work as part of their eligibility. And in Pennsylvania, because these individuals are now getting jobs, we are seeing for the first time a decline in the number of enrollees in these programs, including an 8% decline over the last 2 months. These would-be enrollees are now seeking employment opportunities, jobs, a job that gives an individual purpose, that gives them a foundation, and it gives them opportunity. Again, a hand up and not a handout. And it's amazing to think that work requirements really work. But our work, it is far from over. President Trump is holding our states accountable for waste, fraud, and abuse within our food stamp program. And under Governor Shapiro, Pennsylvania has one of the highest food stamp error rates in the nation at over 11%. So our opponents, you're going to hear them push back, and they're going to say that the federal government will take this money away, and it's going to cost Pennsylvania a lot of money. But at the end of the day, folks, this is your money, the taxpayers' money. And it's time that the Shapiro administration addresses these high error rates, because people receiving benefits that are not eligible for them hurts the people who truly need the benefits and the hardworking taxpayers of this Commonwealth. All of us. I want you to know that all of us will hold the governor and his administration accountable to ensure that this is corrected. We cannot afford the status quo any longer. We will get this right. And as we stand in this historic rotunda, we must remember what makes Pennsylvania strong: hard work, responsibility, and the bounty of our farms. When we choose real food, when we choose accountability, we choose a healthier and stronger Commonwealth. Together, we can make Pennsylvania not just healthy again, but a model for our entire nation. So let's roll up our support our farmers, and let's ensure that every Pennsylvanian has the opportunity for a hand up. Thank you again, Mr. Secretary. Thank you all, and let's get to work.
Thank you, Senator Phillips Hill. The goal of eating real food is simple, to just make Pennsylvanians healthier. But improving health also means improving the integrity of government benefit programs, ensuring that resources are targeted appropriately, reducing waste, reducing fraud, reducing abuse, and keeping those programs affordable and sustainable for both taxpayers and the individuals who rely on them. So now we will hear from Senator Judy Ward, a longtime leader on health-related issues, a registered nurse, and a tenacious watchdog over Pennsylvania's benefit programs. Senator Judy Ward.
Thank you, Representative Rowe, and good morning, everyone. What a pleasure it is to have Secretary Kennedy with us here today and to join him and others in making America healthy again, as well as eliminating waste, fraud, and abuse out of our systems. Welfare fraud is a serious problem. For example, a previous audit by the Pennsylvania Auditor General revealed more than 2,300 deceased individuals received more than $700,000 in benefits in a single year. More recently, between 2019 and 2023, the Pennsylvania Office of State Inspector General filed more than 2,900 criminal complaints of welfare fraud totaling more than $15 million in restitution owed, demonstrating the need for better oversight. 2019 also saw Pennsylvania's payment error rate for Medicaid rise to 14% compared to the national average of around 5%. The cost to the state was $2.4 billion. Welfare fraud like this sends hard-earned taxpayer dollars to criminals, decreases public trust in government, and takes away these benefits from those who truly need them. As lawmakers, we understand the importance of enacting laws that help to prevent this type of abuse from happening in the future, and to ensure these public benefits are administered effectively, efficiently, and correctly. Just this past November, we enacted new reforms and accountability measures to help crack down on this abuse in programs like Medicaid and SNAP, including checking death and wage records to ensure that individuals receiving medical assistance and SNAP benefits qualify for these programs. Despite these strong reforms, we must continue to bring accountability to the Medicaid program. That's why I've introduced the Do No Harm legislation, which will bring much needed reform. Due to the dangerous and controversial nature of sex-rejecting procedures, some hospitals have incorrectly coded and billed for these procedures to get them paid for. According to data from Pennsylvania's Department of Human Services, there was a 2,100% increase in reimbursement for puberty blocker claims using the code for precocious puberty between 2013 and 2017, with yearly totals for minors under 18 rising from roughly $35,000 in 2013 to $800,000 in 2017. However, there was no reimbursement for puberty blockers using this code in any age group from 2010 to 2012. These expensive procedures and hormones getting improperly covered adds a financial strain to the state's Medicaid program and leaves less money available to those low-income individuals who depend on the program for coverage of essential medical services. Worst of all, it harms children. The Federal Department of Justice recognized this problem last year when they sent more than 20 subpoenas to doctors and clinics involved in the performing sex-rejecting procedures on children, including Children's Hospital of Pennsylvania, or CHOP, to investigate healthcare fraud, false statements, and more. We must continue to work with our federal partners to ensure that children are protected and with my colleagues to eliminate welfare fraud and make Pennsylvania healthy and happy again. Thank you.
Thank you, Senator. As I referenced earlier, the effort to make Pennsylvania healthy again is actually a bipartisan one. Last March, Representative Natalie Mihalik introduced a Healthy PA package aimed at improving food safety and public health. Every single one of the bills in that package has at least one, if not multiple, co-primes from each party. Unfortunately, Representative Mihalik could not be here today because she's actually on her way to Washington, D.C. right now to advocate for exactly what we are talking about here today. So in place of Representative Mihalik, I want to welcome Representative Robert Ledbetter, who is another co-prime sponsor of the Healthy PA package, to speak on the importance of this bipartisan legislation. Representative Ledbetter.
Thank you, Mr. Chairman. And as we look to just last week with the conclusion of the 110th Pennsylvania Farm Show, thank you, Secretary Kennedy, for coming back to Pennsylvania here today. Thank you so much. My name is Robert Ledbetter, and I am proud to represent the people of the 109th District, consisting of all of beautiful Columbia County. When Representative Mihalik first approached me about joining her and our colleagues as a co-prime sponsor of the Healthy PA bill package, several things immediately came to mind. First, as a father, I thought of my children and the role that food plays in their development every single day. The role that it plays in their ability to learn and their long-term health into the future. What our children eat matters. It fuels and shapes who they become, and why House Bill 1131 is so important to keep the food that they eat at school from harming their development. The other thing that came to mind was our agriculture community and the strong presence that it presents here in our Commonwealth. These men and women have fed our communities for generations, and they deserve to have those efforts acknowledged, and innovations around cover crops and farming practices to be supported by all of us here today. Our farmers work with care, integrity, and pride, and they deserve policies that protect consumers while respecting the people who produce our food. Finally, I think of the importance of passing House Bill 1134 as part of the Healthy PA bill package to ensure that harmful dyes, addictive additives, and unnecessary chemicals are not quietly introduced into the food supply that families across our Commonwealth consume every single day. While those priorities were clearly shared by my colleagues, it was especially meaningful to see that our work aligned with the national efforts underway at the U.S. Department of Health and Human Services under Secretary Kennedy's strong leadership. Thank you, Mr. Secretary. As Chairman Rowe alluded, this is a bipartisan issue. This is a public health issue, and it is a parental issue. Considering the full picture, the decision to advocate for these priorities was an easy step for me and my colleagues to make. But what remained needed to be done next was going to be harder. What was next was the level of commitment and consistency required to achieve the goals laid out in this very bill package, supporting the efforts of Secretary Kennedy and ensuring that Pennsylvania can eat real food. That broader effort to make America healthy again. This reflection brought me back to an experience that as a homeschooler was perhaps more common than not within my community, but something that several of you may also share as a memory from childhood: successfully hatching an egg. If you've ever done it, you know it is not a passive task. The egg must be turned regularly, the temperature must stay steady, the environment remains stable. You do not see progress day to day, and yet every missed turn and every lapse in consistency puts the desired outcome at risk. Only after days of patient, disciplined effort does something remarkable happen. What once appeared dormant breaks through, and the gift of life is experienced. That is the work before us today. That is the work that is part of this build package, and that is what Secretary Kennedy is a champion for all of us in Washington. We must keep at this task every single day. We must keep doing the work, even when the results are not immediately visible. And we must stay consistent despite the headwinds that may come, knowing that the process itself is what makes the outcome possible. We must keep working, we must keep turning. And in time, as we have already begun to see, thanks to Secretary Kennedy's strong leadership, we will hatch the future of America's health, and we will eat real food. Thank you, Mr. Chairman.
Thank you, Representative. And now the moment we've all been waiting for. It is my high honor to introduce the Secretary of the United States Department of Health and Human Services, Robert F. Kennedy, Jr.
I want to start by acknowledging the leaders from Pennsylvania who've shown real courage on our health system. Representative David Rowe, Senator Judy Ward, Senator Kristen Phillips Hill, Senator Michelle Brooks, Representative Robert Ledbetter, Representative Natalie Mahalik, Representative Jesse Topper, and Representative Jake Manta. I'm grateful for your leadership and for the chance to be here in the State House as we launch our Take Back Your Health tour. We're here today because of the existential crisis in American health. Americans pay 2 to 3 times what Europeans pay for, our peer nations pay for healthcare, and yet we have the worst results in the worst outcomes in the developed world. We already suffer the highest chronic disease burden on earth, and our children are getting sicker by the day. This is not bad luck. This is genetic. This is not genetic. This is not inevitable. It's the result of decades of bad policy choices that have transformed America's once exemplary healthcare system into a sick care system driven by perverse incentives that reward every participant, doctors, hospitals, pharmaceutical companies, and insurers with more money for keeping us sick than they can make from getting us better or from preventing disease. The financial costs of this system are ruinous. Today, nearly 90% of healthcare spending goes to treating chronic disease, most of which are diet preventable or diet induced. More than 40% of every taxpayer dollar collected now goes to largely preventable diet-induced diseases. More than 70% of adults are overweight or obese, and a third of teens have diabetes. When I was a kid and my uncle was president, juvenile diabetes is practically unknown. A typical pediatrician would see a single case of juvenile diabetes over a 40 or 50-year career. Today, 38% of American teens are diabetic or pre-diabetic. 1 out of every 3 children who walks through his office door is diabetic or pre-diabetic. And this is also a national security issue. 77% of American youth cannot qualify for military service, and that should get all of our attention. The administration believes that we need to start focusing on health long before someone enters a hospital. This transformation begins with honesty, with gold standard science, with transparency. And it begins with the courage to challenge all of the entrenched interests and systems and orthodoxies that profit from disease and from keeping us ill. President Trump is alarmed that we're hollowing out the American middle class and America's global leadership with both the disastrous costs of our healthcare system and its cataclysmic outcomes. Pharmaceutical and insurance companies are raking in profits while American families struggle to pay medical bills and children face demoralizing and expensive futures, struggling with crippling chronic diseases. A healthy child has 1,000 dreams. A sick child only has one. A majority of American children today are focused on just having a single day without pain, without suffering, without wrestling and struggling with chronic disease. President Trump wants to end the chronic disease epidemic and restore the American dream to the next generation of kids. In this cause, he is dismantling the old system and erecting a new one built on common sense, technological efficiency, prevention, and affordability. One of the things he's done is through the Most Favored Nation program to dramatically lower prescription drug prices in this country until for 30 years in this country, we've been paying the highest drug costs in the world. We developed the drugs here. 70% of pharmaceutical profits come from our country. We only have 4.2% of the world's population. Why is that? We make the drugs, we pay for the innovation, and the European nations just say we're not going to pay for the drug unless you lower the cost. So at the beginning of this year when I came into office, the cost of Ozempic was about $1,300 listed in this country, and it was $88 in London. And oftentimes we're paying 2, 3, 4, 5, 10 times what the Europeans pay. Every president in my lifetime has said that they're going to fix this problem. Nobody has succeeded. They've all struggled with it, and they found that it was intractable. And yet now we have agreements from 16 of the 17 top drug companies to lower their costs so Americans will be paying the lowest cost of any country in the world. That happened because of President Trump's leadership, him calling me once a day for months on end saying, you got to get this done, calling Dr. Oz at midnight or 2 o'clock in the morning and saying, where are we? And then his adept use of tariffs. Because not only did we have to get the drug companies to lower their price, but we don't want to stop innovation. So we had to be able to make them make enough money, and the only way to do that was to get the European countries to raise their prices, which they did not want to do. But they've now agreed to do that because of President Trump's adept use of tariffs. President Trump RX reduces prescription drug prices for all Americans by giving patients direct access to lower priced medications, often tied to the prices that are paid. The lowest price paid in Europe is what we're going to pay here. We're also forcing insurance to tell the truth about prices and coverage. And through the Great American Healthcare Plan, we are returning power to patients. That plan puts money into the hands of Americans so that they can choose their own insurance. It requires insurers to post their rates and coverage in plain English. And it requires any provider or insurer taking Medicaid or Medicare to disclose prices clearly and publicly. When people know the prices and control their own dollars, the marketplace itself drives efficiencies, lower costs, and better health care. During the transition, Cheryl and I were staying with Dr. Oz, and one day we got a visitor, the former Prime Minister of Australia. After he served as Prime Minister, he was appointed to lead the chair a commission to lower health care costs in Australia, which were astronomical, and to raise the quality of care. And he said the thing that he was immensely successful And the one thing that made the greatest change was transparency, was that people, before they received the treatment, would know what the price was, and that they were able to see their own healthcare records immediately on their cell phones, so they can make good choices about their own health. And we've now accomplished both of those things, so that we have agreements now with the 400 biggest tech companies to stop information blocking, so that every American will be able to get their healthcare records on their cell phones. We're forcing insurance companies and hospitals to post their prices in advance. President Trump means to transform every American into the CEO of their own health. Doctors under this new system are going to regain their independence, patients regain their dignity, and the costs will come down. But let me be clear, we're never going to fix this country's healthcare system by changes in the ICD codes. We have to confront the root cause of disease. The United States leads the developed world in obesity, diabetes, fatty liver cancer, food allergies, autism, autoimmune disease, especially in children. When I was a boy, America had the healthiest children in the world. Today, we have the sickest. That's why the Trump administration is changing course. Earlier this month, USDA Secretary Brooke Rollins and I released the dietary guidelines for food. These guidelines represent a dramatic break from the past. As you know, the dietary guidelines in the past were crafted not with the idea of public health in mind or good science, but with politicized science driven by the mercantile ambitions of the big food processing companies who had captured the FDA. And that impulse, that commercial impulse, is what drove Fruit Loops to the top of the food pyramid. And they told us for the last 40 years to eat as much as we could of refined carbohydrates, of ultra-processed foods, to stuff ourselves with sugar and salt. They poisoned an American generation, and we're now feeling the effects. And we are now cut through the red tape, and we're telling Americans it's time to start eating real food again. And these guidelines tell us what we ought to know. You ought to eat a lot of protein. You ought to eat dairy. You ought to eat eggs. You ought to eat meat, fruit and vegetable, and high fiber grains. And these guidelines are going to drive the dramatic changes in dietary culture in this country. How are they going to do that? Well, it's going to change what the military eats. It's going to change what we feed patients in the VA hospitals. It's going to change what we feed children in the school lunch programs. It's going to change. Brooke Rollins' agency gives out $405 million a day to food subsidies in this country, to programs like Head Start, to the WICS program, to school lunches, to the SNAP program, to the Indian tribal programs. And the food that they were getting reflects the dietary guidelines. They're getting processed food. Now they're not going to do that anymore. They're going to get real food, and it's going to drive changes in the marketplace. One of the things that we're doing is we are requiring that every outlet that accepts food stamps double the amount of real food that it sells in its facility. And this is going to change the marketplace, and it's going to make real food affordable for every American and accessible. And the guidelines also support American farmers and ranchers, the people who produce the real food, and have been pushed aside by the consolidations and corporate capture. At HHS, we are making safe, reliable, and nutritious infant formula available to American mothers. Right now, we're doing the most comprehensive studies ever done on contaminants in our infant formulas, things like cadmium and mercury and lead and PFA acids. Those studies will be out in April, and we will be able to see all of the different contaminants that are in the formula. We also are revising the recommendations for nutrients. Right now, there are 30 required nutrients. That list is 30 years old, and it's not based on good science. You know, it's archaic science, and now we're changing that so that we're going to be regulating baby formula companies so they're giving you something that is as close to mother's milk as we can get. That provide all the nutrients that your baby needs for brain growth, for physical growth, and for good health, and for proper immune system development. We're also getting rid of the food dyes. 9 food dyes, we're getting rid of all of them. We got rid of 3 last year. We're getting rid of another 6 this year, the last 6. All 9 of them are going to be going to petroleum-based synthetic food dyes. And we've already fast-tracked the approval by FDA of 4 vegetable dyes, which are going to replace those. So we're working with the industry to make sure they can make that transition. We're reforming school meal programs, and we're using technology and AI to identify fraud, waste, and abuse, and to cut red tape so they're real cures and get to real people faster. The FDA is on track to approve a record number of breakthrough treatments. We are restoring gold standard science at NIH and directing research toward the root cause of disease. And we're confronting the over-medicalization of our children, and also we're confronting the issue of screen time. We're working across the country to reduce screen time by children, which is we are restoring rural health in this country. The rural health system is in crisis. And we are pumping in, under President Trump's leadership on the Rural Health Transformation Program, $50 billion over 5 years to all the different states, their rural programs to rebuild infrastructure, to retain the best doctors and nurses and healthcare providers, and to transform themselves with AI and with new technologies so they can do better diagnosis, better care, and better link up with hospitals and specialists all over the country so that in rural hospitals you'll be able to get first-class care. The amount of money is astonishing. It is a total of 1/3 increase in federal monies to rural health care. Historically, a 1/3 increase for the next 5 years, and it's going to allow these rural systems to save these vital hospitals, which are not just healthcare providers. They're also the centers of culture and economic drivers for those communities. I want to recognize Pennsylvania for doing your part. This state passed the Whole Milk Healthy Kids Act of 2025, putting nutrition back into school lunches, and you passed the Healthier Choices for SNAP, helping families access food that nourishes rather than harms. Those laws show what leadership looks like. This Take Back Your Health tour is about telling the truth and recognizing the extraordinary leadership of legislatures who are driving MAHA agenda state by state. And it's all about accountability, and it's about putting families, especially children, back at the center of American healthcare. We're not going to be able to medicate ourselves out of this crisis with our children. We can't subsidize sickness forever. And we can't accept a future where chronic disease is the status quo. And I want to thank particularly President Trump and the work of this administration. With their help and leadership, we're going to make America healthy again. Thank you all.
thank you very much, Secretary Kennedy. Thank you, all of you, for being here today. Thank you to the members and Treasurer Garrity for attending. We are going to take a few questions from the press at this time.
Well, our revisions, our recent revision of the vaccine schedule makes what we believe in the best scientific judgment about how Americans can protect their health. But they also recognize that other people may have opinions. We don't take the vaccines away from anybody. If you want to get a vaccine, you can get it. The vaccines from the old schedule, and you can get it paid for by your insurance. Some states may choose to take a different pathway, and I think we envision that different people would be doing different things, but it ends the coercion, and it ends it's for the first time we are looking at the science about the risks of vaccines. And we're adopting the same schedules that our peer nations use in Europe, and we think we're giving the best science and the best judgment that looks at both risks and benefits to the American people. Pharmaceutical companies. I mean, we want the pharmaceutical companies to prosper. We are the center for innovation in the world. We are asking the pharmaceutical companies to reshore their production here. They are doing that. They're now spending tens of billions of dollars. I think Eli Lilly is building 6 new plants, including a major API plant, which develops the precursors for a lot of national security interest pharmaceuticals in our country. Novo Nordisk is building 4 plants in North Carolina, and we're working with the pharmaceutical company. We made them lower prices. We are making them do good science on vaccines and other, on everything that has to go through FDA. We don't want American pharmaceutical companies to lose their innovative edge. And that was one of the assignments that President Trump gave me. He said, I want them to reshore, I want them to continue to innovate, and I want them to dramatically lower prices. We were able to do that in a way that the pharmaceutical industry actually profited enormously. And we gave them that certainty. The stock price of those companies have gone up by over $1 trillion. We're not trying to hurt the pharmaceutical industry. We're trying to help them, but we're trying to put the American people first.
We're going to take 2 more. Up to you. You can read down if you want to get it. Could you repeat that one more time? Hard to hear up here.
China has vaccines and your vaccine policy has generated backlash. Food is a more bipartisan issue. Is food going to be a priority in 2026 if you consider it a winning issue?
Is food a priority, and do you consider it a winning issue?
Is food your priority in 2026 for vaccines?
Our objective is to have good science and allow Americans to make their own choices based upon individual health. I think it's just an important issue from a public health point of view. Whether it's a good political issue, I wouldn't know. It's something that I've been fighting for many years. We need good safety testing for all of these products. When I was a boy, I got 3 vaccines and I was fully compliant. Today's children get between 70 and 92 doses, and they're exempt until this time. They've been exempt from pre-licensing safety studies. Of all those vaccines, only one of them has ever gone through a randomized placebo-controlled trial prior to licensure, and that was the COVID vaccine. The other ones, we don't know what the risk profile is, and we need to know that so we can give good information to doctors, to physicians, to regulators, and to American parents.
We got time for one more.
Thank you, Mr. Secretary. Cheryl Case Holder from the New York Times. Actually, two. I have 2 questions for you. First, the food pyramid graphic actually sends a little bit different message than the written guidelines. The pyramid shows meats and other fatty foods at the top, and the guidelines suggest limited saturated fats. So I'm just wondering which do you think Americans should follow? And then separately, I've talked to many of them. Many of them would like you to run for president.
Is that a question? Yeah, I'm not running for president. I didn't really get your question about, I heard something about protein and saturated fats.
The question is that the food pyramid sends a bit different message on saturated fats than the written guidelines.
Well, we struggled a lot. We had the best scientists in this country from the best universities. We had over a dozen of them who worked on the dietary guidelines, and it's all science-based. I think they were hobbled when it came to saturated fats by a lack of really precise science about what that level should be. They chose a conservative level, which was not over 10%. The science was clear enough on proteins that we should dramatically increase our input of proteins. And so that is the advice that we gave. And they're not perfect, but I think that they give guidelines that are going to be very useful to people and that are going to be much, much better for public health than what we